Hello and welcome to another edition of 41 Files here at 41 Action News. Taylor Hemness here with you, anchor of 41 Action News today. So glad you're here with us for what we hope is a special edition of 41 Files podcast. We haven't for a while in a podcast situation like this, and we're excited to do this very special one today. I keep saying we because I'm joined by two of my colleagues who are taking part in a live Zoom call right now. 41 Action News anchor Cynthia Newsom is here with us, and 41 Action News reporter Jordan Betts. Ladies, thank you so much for taking part in this alongside me.
Good morning.
So if you're familiar with anything we've been doing on 41 Action News during our pandemic coverage, which has been a lot, and we hope you are familiar with it, just this week we launched a new initiative that we're calling the Rebound Kansas City. And we are very, very focused on moving forward now that states and cities are starting to lay out their plans to reopen businesses and reopen the economy and get people back to some sense of normalcy. We are very focused on that as well, and trying to understand what that means from every different perspective, whether it be for financial rebound, whether it be getting back to work, your personal situations. And the focus of today's conversation and podcast is the mental health aspect of bouncing back from this, the mental health importance of bouncing back from this. And so each of us, Jordan, Cynthia, and I have all invited someone to take part, or someone's to take part in this conversation. And we're going to introduce them now, and then Jordan is going to begin the conversation a little bit, and we'll let this go, and you're going to hear lots of voices here. So we'll try to keep track of who you're hearing. But I'll start. I invited Danielle Nash. She's here with us. She's a licensed clinical professional counselor who specializes in marriage and couples therapy. So you'll hear her opinion on everything, but also on specifically what it's like to deal with a marriage and couple situation right now, and something that a lot of people are learning new things about their relationships during the course of this stay-at-home order. Danielle, thank you for being with us.
Thank you for having me.
You bet. Cynthia, tell us who you've got here with you to talk about today.
So we have Dr. Jennifer Prohaska, who is a clinical psychologist with the Kansas City, Kansas Fire Department, and she specializes in first responder psychology. She's a PhD, and she's one of only 70 in the country with this expertise in counseling specifically for first responders. So we're glad to have you here, Jennifer. Thanks for coming.
Thank you, guys.
And then we have Catie O'Connor, and she's really kind of doubling for us. She's a KCK Fire Department paramedic, as well as a mother of 6, and her husband is a former firefighter with the Kansas City, Kansas Fire Department. So she's got a lot of perspective of being a mom, you know, being in the business of being a first responder, which is no easy job. So Catie, we're glad you're here.
Thanks for having me.
Jordan, who have you brought to be part of the conversation?
Yeah, I have Dr. Gordon Nawalnik. He's the clinical assistant professor in the Department of Psychiatry and Behavioral Health Sciences at the University of Kansas Medical Center, as well as he's the clinical director of psychology services at the University of Kansas Health System, Strawberry Hill campus. So we're going to be talking definitely a good person to have when talking about all things mental health right now. So thank you, Dr. Nawalnik, being with us this morning.
Of course. Thanks so much for having me, Jordan.
So Jordan and Dr. Nawalnik, we're going to start with you because the broad brush you're painting with a little bit is just talking about maybe not only the importance of counseling and therapy at any time, but in a time like this. And if someone has decided through these last few weeks about, hey, maybe it's time for me to talk to someone, or maybe I need to after some of this time, how do they go about that? And that's something we're really interested in hearing about from you, Dr. Nawalnik.
Yeah, I think, I don't know if I should start now, but it's, right now, I think what's happened is during the lockdown order, I mean, going into it, everybody was already at peak levels of anxiety and depression. And then you close people in with family or spouses or kids, tell parents that they've got to teach, continually over time, reduce different job stability, financial impact starts to set in. All the effects of this, it's a global situation that's no one's left untouched. And the concern that we have is that people are not reaching out because they just presume that the services aren't available because so many things have been shut down. And what's great is that, so many providers, and I'm sure the other panelists will speak to this, have been able to shift over to platforms just like this, where you can get a clinical license through Zoom, or any of the other secure online platforms. And so we're almost even more available than we've ever been before. And so the only barrier there is for people who just guess that they can't find us or don't know how to find us. And then the other piece is people that maybe have a sense of collusion between a medical hospital and then a psychiatric hospital when they're actually two very separate things. And that I know of our specific psychiatric facility at Strawberry Hill, we have a number of screening processes in place. And so you're probably actually safer coming into an inpatient psychiatric unit for treatment when you're at that critical level of breakdown than you would be going to Walmart or the grocery store or Target. And yet people don't hesitate to go to those essential locations, but they're not reaching out and getting the care they need. And I know that at our child facility at Marillac, we're having a real situation where we're encountering people after the attempt rather than before the attempt. And at Strawberry Hill, we've seen our numbers, we spiked when it first started, and then we've had, we reduced our census slightly just to allow for social distancing with our patients and our staff on the units. But our census has been even below that because people, I think, just see KU Med and they think, oh, that's where all those COVID people are. I don't want to go there because I'll catch it. And in reality, that's a myth. They'd be very safe. And so we just want to encourage people to make sure that they're checking in with themselves and acknowledge the overwhelming feelings that you're having and know that there are so many supports like never before available in terms of hotlines, warm lines. Any professional organization has a website that you can reach out to, whether it's a marriage and family therapy website, the psychology website through the state, psychiatry. There are infinite number of referral sources to find people. And so we want to make sure that we're encouraging people to do that, because whereas Corona might not kill you, untreated depression absolutely will in time. And so we just want to make sure that people have the awareness and know that we are all still manning the lines. And though therapy might look a little bit different, it's still very effective, and we have the tools to support people through this.
Yeah, Dr. Nawalnik, trying to find a good therapist, they say, is like trying to find a good boyfriend or girlfriend. That first interaction is so crucial sometimes when meeting someone, especially someone you've got to trust ultimately. You're expressing some deep, dark feelings that you have, especially during this time. And we don't get that face-to-face interaction. How are you helping people find that good, perfect therapist for them when they're not having that face-to-face interaction?
So, there's a website, Psychology Today, which is a publication. They've had this website for years that lists across a number of disciplines, and it tells what people's areas of interest are. You get to see typically a picture of them. Not to say that that's what you want to base your decision on, but for some people, it helps. And whatever you can find to help you feel a little more comfortable with this individual, to take that first step and reach out, do it. There are also a lot of providers that now have websites that you can read about them. Some therapists include little bits of personal interest about them. But the therapeutic relationship, as you described, is very unique. There is no sex in a therapy relationship. So as far as being boyfriend or girlfriend, that's not a thing. But we are certainly very close. You're inviting this individual who starts out as a stranger to very much inside your life. And oftentimes in therapy, you share things with your therapist that you wouldn't share with a spouse or a family member. And it becomes a safer space where there's no judgment and no worry about questioning, can I say this, can I not? But I would say that when you start working with someone, if after the first, give it a few sessions, but after 2 or 3 sessions, if you're really just feeling like you're not clicking with the person, they're not hearing you, you don't like where they're coming from, how they work, by all means, try kissing another frog. You'll eventually get to where you need to be and find somebody that's really going to work, because otherwise you can wind up 6 months down the road and have never had that meaningful connection. And so much of the research out there speaks to the power of the relationship as being the curative factor. And if you're not comfortable with that relationship, all the data in the world and all of the techniques in the world aren't gonna help you, because you're not gonna have that buy-in.
Yeah, and we're facing during a time where a lot of people, we've never, I'd say probably all of us have never experienced something like this before. And probably therapy is also something people never experiencing before, but right now we're having to put the two together. What advice would you give someone right now that's going, oh, never seen a therapist, not sure if that's the thing for me? What advice would you give them of how they start that process?
I think it starts with recognizing that there's there's this fictitious separation between physical health and mental health. And while granted, a lot of people really neglect their physical health too. I don't know how many people actually maintain routine doctor appointments, but we know they should. In the same way, therapy, we've seen it on a number of TV shows in terms of, and it has this kind of, I don't want to call it a stigma, but people think they know what it is. And I would say that it's a really good idea just to give it a try. People experiment with different things in their life all the time that are far less beneficial than therapy. And they don't give it a second thought. But therapy, for some reason, people think, well, if I reach out to a therapist, I've got a lot of problems. And I think it was very powerful the other night on Stephen Colbert. He and a stand-up comic, John Mulaney, were talking, and they were both revealing, talking a bit about their interaction with their therapists, which I think those two are really doing great, and they're crushing it at life, but yet they have therapists. And it's very important to recognize that you don't have to be a broken, shattered individual to benefit from individual therapy. And it's amazing how in such a short amount of time, just having an unbiased perspective on your life can help you to benefit and address so many issues that you might not even have been aware of.
No, I fully agree with that. And my last question to you is, right now it doesn't seem like this will ever end, for someone like me who thrives being in an office and being near people. What's that message of hope right now is, this is going to be a long process for us to get back into the office and for us to do these things. What's your message to hope to people right now of how to keep going during this time? Because this isn't the end.
I mean, it's a very frustrating time. And unfortunately, with anger and frustration, our ability to, basically, process information declines a little bit. We make our decision-making process goes on the slide, and our overall impulse control goes down as well. And so the people who are really chomping at the bit to get out, and I'm hearing, I don't do Facebook, but my wife does, and she just gave me a little tiny snapshot of what's going on out there right now. And it's getting kind of nasty and kind of ugly with people who both sides swear they're right. And we don't know who's right and who's wrong, but we do know that people are just ready to fight with anybody about anything. And I think that it's important to recognize that this is a process, and reopening might not be a throwing open of a door as much as it is a dance of we go this way, and eventually we find our pace and we find what really works. And I think that as long as we can stay focused on why we're doing what we're doing and what the benefit of this is, and that if we would have maybe had a stronger shutdown where we did less, we could be further along than we are now, but we can't look backwards. There's no looking back and saying, what if, all we can do is learn and go forward and try to be better. And I think that the more that we can be doing deep breathing and different coping skills that are very adaptive, and you can find those anywhere online. I've spoken about them with you before. These are the things that are going to help us to get through and make the best decisions for us, our loved ones, our families, and our careers. So that we're eventually recognizing that we'll get there. We just have to try to support one another through this and recognize each other's opinions without trying to beat each other in the head.
Thank you so much, Dr. Nawalnik, for doing this morning. I really appreciate it. And Cynthia, I know you have someone that, looking into perspective is not only a paramedic's perspective, but also a mom's perspective. And we'll kind of go to Cynthia now with who she's interviewing this morning.
So one of the things we have to talk about is we love our first responders, those people on the front lines. They are close to us. They are near and dear to our hearts, and the jobs that they are doing, risking their own lives often, and really concerned about their own families. We just want them to be healthy and to be safe, and they too are people, and they're going to need some mental health services. So, Dr. Prohaska, we're going to have you talk about a little bit about that. But Catie, let's start with you. first, and just talk about, you're a first responder, you're out there on the front lines, responding to these calls, and then you have to go home. What are you experiencing in terms of your mental health, in terms of your emotions, your stresses? What are your greatest fears?
I feel like when we run the patients that are a possible patient that is like positive, there's just a heightened sense of fear. We don't respond any differently, but emotionally, I'm like, okay, I need to take the extra precautions and the protection so that I don't bring this back to the station, so that I can make contact with something that, you know, my coworkers are touching now, and they can take it back to their families also. So it's a little bit of a fear, and because we're trying to protect each other also. But just knowing that have that possibility of bringing it home to my kids, it is very stressful. But we do take the precautions at the station. We clean. Our department has done an outstanding job responding to the challenges that they've met, with getting us the equipment that we need, the cleaning supplies, the extra staff, so that they can come and decon our ambulances after a call, decon our stations if needed. And we're bringing in our own clothes from our home and then showering at the stations and cleaning everything prior to going home, so that it reduces that spread.
And so, Dr. Prohaska, talk about this, because you're experiencing more people coming to you and needing help. What are their concerns and fears, and how do you address that? What do you say to them?
Sure. So I don't just work with fire as well. I also work with PD, so law enforcement as well. So it's kind of a blend. It's a little different between fire and PD, what kind of stresses I'm seeing. With the fire stuff, I'm seeing a lot of what Catie mentioned with regards to like concerns about contamination and bringing it home to family. But on the PD side or law enforcement side, what I'm seeing instead is concerns like from my detectives, my sex crimes detectives, about people who are sheltering in place with potential abusers, juvenile all the way through adult. And then also like concerns about domestic violence and things that happen with regards to that, and how busy they're going to be after some of the stay-at-home stuff lifts, and also feeling like they can't protect those people who have to shelter in place with their abusers. So it's kind of different depending on kind of I think PD is also concerned about contamination and bringing it home to their family as well, just a slightly different kind of flavor behind their fears and their worries.
How do those concerns translate into what happens on the job, and how they handle things on the job and how they handle things at work? What's this causing and triggering?
So a lot of it is just leading to like kind of increase what we call allostatic load, which is just stress on a system. And you can kind of only bear so much stress on your system. First responders have a ton of stress to begin with on their system, merely just worrying about, am I going to be safe on a call, and what's other people going to be doing can kind of cause their own stress levels to increase. Then you just add the fear of an infection on top of it. And so the load of stress is increasing. So what I'm seeing a lot of is some increased irritability, a lot of increased generalized anxiety and worry, and then difficulty focusing, definitely difficulty focusing and making decisions in their home environment. So it's leading to a lot of conflict at home, I would say, a lot of more stress at home.
Some signs and things that we need to look at and understand as the spouse of a first responder, as a friend and a neighbor, and someone in the community. How do we try to help reduce this? Is there something that we can do?
I think just being compliant, the officers and all first responders are going to be as nice as possible, but just understanding that the entire system is stressed. So if they ask you to do something, we're doing it for everyone's safety, not just for, not just because we want to be mean or whatever. And I think Catie can probably talk to that too, but it's just, we want to make everything as easy as possible for people.
Yeah, Catie, let's talk about it. So this is just a conversation. Anybody jump in, but let's talk about it. How can we help first responders and help them reduce the stress that you all have, Catie?
I think a lot of it is just one of the bigger things is we're seeing people not calling 911 because they're afraid that they're going to be transported to the hospital and they're going to get this sickness. And
Wow.
We want people to call us because, this is just another sickness that we're dealing with. We're not responding any differently other than protecting ourselves a little bit more and cleaning a lot more. But the professional response is still there, and we encourage people to call. But now we're getting the calls when it can be too late. You know, they've seen symptoms for a few days, they're having an issue for a week, and now it is a true emergency. And so as a responder, that is a stressor for me personally, because we have this generalized care for, I guess, the community that, you know, we want to provide that type of care.
If you might mind asking, this is Jordan. I see first responders, you know, when I'm driving out, I see you guys going somewhere. And you know, I'm already a little bit nervous, you know, meeting people that, you know, anyone really could be exposed. How do you stay mentally okay when you're going into somebody's home and you're giving yourself the possible exposure of this? How do you stay mentally okay with that?
Well, what we've resorted to is, because as we've found out, you can have it and you can be carrying it without symptoms. So the way that we're responding to the calls now is full protection from the beginning. We have goggles, masks, and gowns, and we send the minimum in. So me as the paramedic, I go in and I conduct the first few questions from 6 feet from the patient. But that kind of resorts to a whole different challenge, because now it's taking away really the best way that I care for people. And it's just compassion through a smile and a conversation and touching their hand and just letting them know that it's going to be okay. And now I'm doing it through goggles and a mask. So it's, I don't know. Did I answer that okay?
It's definitely not
Yeah,
easy.
you did. It's tough.
So talk about the challenges with the children when you come home. Is there a challenge? Do you see yourself having to manage more stress because of the kids are home now and you're having to take care of them? What are your thoughts there?
In the beginning, when we first found out that they were not going to be in school, it was a tough thought to really just, you know, absorb, because whether you have one child or 6 children, you know, I know that everybody makes priority, you know, being their education. And now I'm the teacher. Or at first I thought I was really going to be the teacher. But I think after the first couple of weeks or so, all of you know, our facility where our kids go to school, they really did rise to the challenge, and they've taken a lot of the burden off of me, because it is now, it's organized, it's seamless. My kids have really stepped up to the plate. They really have taken what they've been given and just I guess without having their friends, it's been a little harder for them.
So the relationship there between you and the kids is fine.
Yeah, it is. It's
Dr.
a lot
Prohaska,
trying to
let's
keep
talk
them
about-
quiet.
Dr. Prohaska, let's talk about solutions. I mean, we want this to be a practical solutions, you know, event and experience for people that are listening. So what can you say? And this might be something that helps first responders or other people.
Sure.
What are some tips that you can say and give, some things that they can practically do, specific tips?
Sure. So big picture thing or theme, I would say, is focus on what is actually in your control. A lot of times people will get worse mentally. They'll have increased depression, increased anxiety when they focus on stuff that they can't control. So the big thing I would say is just be mindful of what are you thinking about? Are you spending your energy and time thinking about things in your control? Or are you thinking about things out of your control? Out of control is going to make your symptoms worse. Stuff in your control is going to make you feel a sense of efficacy and being able to kind of feel like you have a little bit more power over the situation. So that's the big picture tip, I'd say. Some smaller stuff, I'd say, one of the really important things is to find some stuff that makes you distracted, honestly. Sometimes we just got to distract, especially when our anxiety gets really high. And so have some go-to activities that are healthy for distraction. And so usually what I tell people when we have this type of stress is find stuff that is like generative or creative, something that makes you feel like you have a clear start and finish to the project you're doing. It's new, it's novel, it's something you've never tried before. These are things like gardening, playing music, fixing a car, this kind of stuff where it's very hands-on. It's something that's slightly challenging, but it's not, not too hard, but not too easy. So it keeps you mentally engaged. Those are the best distractors. So distract yourself when you need to. The other thing I tell people is be mindful of how much you're consuming media that's maybe not very helpful. So you can go down a rabbit hole and take an exit to a place in your mind that's not very healthy when you can get on social media and kind of, get inundated with people with a lot of negativity. And so just kind of put time limits on it even, do 5-10 minutes and then cut yourself off. Don't keep going. Pay attention to what's happening to your mood state while you're doing that stuff. If it's getting worse, stop. Do something else, find something else distracting. It's hard to do, I'll be honest with you, in these times, because we think, more information has got to be better. Sometimes more information is not better. Sometimes it makes us more stressed. So those are like the 3 things I would say to really quickly kind of switch your mind over to something else. So
very helpful. All right, Dr. Prohaska, thank you so much.
Sure.
Katie, I want to ask you too, and I got bumped off of the Zoom call for a second, so I hope I didn't miss this, but do you mind telling us the age range of your 6 kids?
Yes, I have a 16-year-old daughter, a 13-year-old son, a 10-year-old son, a 7-year-old daughter, 5-year-old son, and a 3-year-old son.
Wow. So
yeah.
Independent of your role as in your professional life, do you and your husband consider yourselves, do you see yourselves as different parents now than you were 6 weeks ago? Not better or worse, just do you see yourselves as different parents than you were 6 or 8 weeks ago?
Oh, yes, absolutely.
I know that I am. I have 3 little boys. I want to bring in Danielle Nash here because Danielle specializes in marriage and couples therapy, and I'm sure talks about families a lot. Danielle, I have to be curious here what type of calls you're getting related to the pandemic, because I'm sure you had a steady clientele of conversations you were having with people before all this started. Has it taken a different tone now that people are, for lack of a better word, stuck at home with their spouse?
Yeah. Well, actually, I've experienced a little bit of what everyone else seems to experience, where there's less calls. And so a lot of my colleagues, people are afraid to reach out. And I would just piggyback off of that initially to say, people in the private practice field, we have worked really hard to transition so that we are available. We spent weeks getting everything prepared so that when people need to reach out, we are there. And so I would just piggyback off saying we have what Katie was saying, like, the compassion, like that is our greatest gift that we can give. And it is different online. It is a different feeling. But we've been working, even having forward conversations with clients, my own clients who know me, who have sat on my couch for years, transitioning to online. We had to have a lot of conversations around what that was like. And I led those conversations. I helped them put words to, it's different. It feels different. I'm going to look different. I'm going to talk different. I even, I do things to help them understand when I'm looking down, I'm just writing. Because when I'm face to face with them in a room and I look down, they know what I'm looking at. But on screen, they have no idea what I'm looking at. And that can feel anxiety provoking and all those things. So I'm doing my best to just bring those conversations to the forefront with my own clients, let alone, people that have never done therapy. So I would just, I would again piggyback off to say the mental health field we are aware of that, and we are wanting to step into that with you. And, when you're reaching out or trying to find somebody, if you were to say, this feels scary or it feels anxiety provoking for the first time to be reaching out and to be doing online therapy, just say that. Let the potential therapist know that is your experience. And, if it feels like they can take that in and hold that, they might be a good fit for you. Right. And if maybe they don't respond in a way that feels comforting or caring, or that they really understand the dynamic of the difference of online versus in person, then, like was said earlier, you get to try different therapists. You get to transition and find a good fit for you. So I haven't had a massive increase in calls, but I have had a different sort of experience with my couples. Some of what's been said previously, that there's already kind of stress in a relationship, and then you add on a pandemic, right? So personally, and for my clients, one of the things that's hard is we're living in the present, which is a higher level of anxiety. But when we go into higher levels of anxiety, our neural networks go into our past. So they're reaching back into like, well, that was scary back there. Like when mom was in the hospital last time, that was terrifying. And so what happens if she gets it now, right? And so unconsciously, our brains are not just anxious about now, they're actually pulling up historical memories, but nobody knows it, right? Like actually it's just coming out in more anger, or it's coming out in distress, or it's coming out in our parenting. And maybe we are yelling more, or we are like going into our own states of panic, and we just want our kids to get their act together when they're in their own states of trauma, trauma states as well. And so I think, in these spaces, it's just, for my couples, it's just been slowing those things down and trying to get underneath that it is both present, and some of this feels really historical. Like, actually, we've been here before. And my system is not only afraid of what might come with COVID, but also remembering what has happened that maybe was not processed, right? Unprocessed trauma or historical memories and events that we haven't even touched yet. So we're holding a lot, right? Like these couples, these families are all holding a lot. So there's a lot going into these moments.
That's a scary thing to think about, of what may be there that you're not aware of when you bring into these situations. I'm curious, because we're getting ready to reopen things coming up next week. We're recording this on Friday, May the 1st. We're getting ready to reopen things. Do you plan to, or when do you plan to reopen your doors so people can come back and meet face to face with you?
Yeah. I personally feel ready to start having people back in my office, but what I've been saying to my clients is it's up to them. Some of them are going to be so ready to get back in my door. They are like over the online thing. They are ready to be back with me in my office. And then others, whether that is just because it's anxiety provoking or because they are immune compromised, they're going to take longer. And I am okay with that. Like, I've literally just said, as long as you need. I will do online as long as you need until you're ready and you feel comfortable to come back in. So I'm being pretty fluid. I personally feel ready to see my clients again face to face.
And as you get ready for that, and whether this continues online or in person, what kind of fears are some of your clients expressing to you about things they may have learned about their spouse or significant other along this time? Again, spending so much time with them, maybe more so than they're used to spending. I'll use my wife and I for an example. I am gone a lot of the time for my work. Obviously, I'm here, but she was just talking about this last night, that she is scared about this going away. And we were talking about, do we feel like we've wasted this 6 weeks? As we're here at the end, potentially we might be able to start doing other things again. Have we wasted this time as a family, as parents? She said, there are things that we do now that I want to keep doing, puzzles at night as a family and that kind of thing. What kind of fears have some of your clients expressed to you about going from this back to quote unquote normal?
Yes, I've had clients talk about a spouse maybe that travels a lot. And so they are single parenting it the majority of every week, and they've had their spouse with them. And they have felt relief, actually. They have felt a burden lift. They've not had to make every single meal. They've been able to tag team, right? And they have started to have some anxiety about, I don't want to go back. I don't know if I can go back, because the level of anxiety that I was under was already crippling, and I got relief from it. And I don't know if I can go back into it. And so I've just been encouraging the communication about that literally just talk about this, talk about what's been important, talk about how it's felt different to have your spouse take on different roles or to experience them differently. And I would just say, we get to change. We do get to make different decisions. There might be some, your spouse might have to go back to traveling, but you can still do puzzles at night. You can start saying no to so many activities. You really can. We do have the agency to be able to say, there are things that I felt, that I experienced. There was laughter or joy or togetherness that we haven't gotten to have, that I want to hold on to. And it's just about letting your spouse, letting your partner know that that's actually something that's on your mind. It might be on their mind too, right? So it's just about starting that conversation.
Well, obviously, we cannot thank each of you enough. This has been a pretty incredible conversation just from every aspect we touch on it. And we know if you're listening to this in your car at home, and this is a podcast format that you're able to listen to, the areas of mental health and mental wellness are vast. And there's lots that we maybe didn't cover here. Maybe you're not in a relationship or in a marriage. Maybe you're not a parent. Maybe you're not a first responder. There are things here we didn't talk about, and we know the purpose of this was to hopefully maybe help you think about some different things that you haven't considered before. And there might be some options that are available to you that you've never thought of. So on behalf of Jordan and Cynthia, I want to thank Dr. Jennifer Prohaska, Catie O'Connor, Dr. Gregory Nawalnik, and Danielle Nash. Thank you all for being here. We're going to tell you now you're welcome to leave the Zoom meeting, because Jordan and Cynthia and I are going to talk a little bit about what we heard and just engage with viewers a little bit about what might be possible from this. But we can't thank each of you enough for taking some time out of your day and sharing your thoughts with us. Thank you all.
Absolutely.
Thank you, guys.
Thank you.
You're welcome. Thank you.
So as that group begins to leave the Zoom meeting, I want to bring back in my colleagues here, Cynthia and Jordan. Ladies, what did you take from this? What was something that maybe stuck out to you about that conversation?
Yeah, I mean, I think, hearing from, I did a story earlier this week about, patients not going to Miralac, which is Key's mental health facility for, teens and children. But to hear it's not only them, it's adults, it's marriages, it's everyone that's experiencing this time where they're not going in to get the help. And I feel like, if we all had COVID, we'd all go and want to be fixed and want to get healthy, but our mental health is the exact same way. We want to get help, and we want to be okay mentally and physically. So I think it's so shocking and also sad at the same time to know that, people aren't going in to get help during this time when I think everyone's kind of struggling in a sense. If that
The
sounds
most powerful
strange,
thing that
yeah.
he said was when he said, there's diseases and things that we have, but mental health, if you don't get what you need, you could surely die. Wasn't that
Yes.
amazing? Wasn't that
Yeah.
powerful when he said
Yes.
that?
Yes.
Truly.
That was big. That was big for me. I thought, wow, without mental health, we could die. I mean, we would rush in if we had a heart attack, if we had,
Mhm.
that was awesome.
And
Yeah,
it's
I
to
totally
be kind of I hope this is not a stretch, but we've heard even President Trump call the coronavirus the invisible enemy here. And I think that's not a weird thing to think of when it comes to mental illnesses, whether you want to say mental illness or mental oppression, mental stress, that kind of thing, things that you're not necessarily looking at every day. Something that may be right in the midst of with you in your vehicle, with you at your desk, with you at your home office, with you at your kitchen table, that you're just not thinking about, that you may carry with you long after this. And that was jarring to me to think about as they all discussed some of the things they're encountering.
Did you all notice that even though they are dealing with their own issues, the paramedic, they're still concerned about doing their job well and helping people, and being forced to wear the mask and the goggles and be far away?
Yeah.
Is a concerning stress for them, because they want to deliver that amazing service where they're close and connecting and making contact. And I thought that was amazing, that with all of the stresses and everything that they're thinking of and all that they see and have to do and at home.
They're not really worried about themselves. They're worried about the other people.
Yeah.
Well, and
it shows you how truly amazing our paramedics are here in town. The fact that, they want people to be able to see them smile and not thinking about, the fact that they're exposing themselves. I think that truly shows how amazing our first responders really are.
It was humbling to me to hear Catie talk about that, because she has a much more important job than I do, and she has twice as many children as I have. I'm regularly thinking about how can I continue to do my job well when I come here to the station, and how can I continue to be a good parent and spouse at home. And to hear her describe, oh yeah, I've got 6 kids and I'm literally saving people's lives, was incredibly humbling to hear. And think, you know what? I think I'm going to be okay. There are people who are much worse off than me, and not I say worse off, but have much more on their plate than me. And I think some people are not necessarily comforted by thinking there are people that have more on their plate, but in this case, I definitely was.
Agreed.
That's pretty amazing. And we got some great tips. We got some, amazing advice about distract yourself.
Yes.
Distract yourself. When you're worried, you are hanging on to that thought of, oh my gosh, how did this happen? How could I have let it happen? What do they think of me? And you're so absorbed in that. Distract yourself. Wasn't that amazing? I mean,
Yes.
I thought of that personally, of things I need to maybe do. Maybe I need to take up gardening or something.
Same. I'm taking up cross stitching. So there's a good one you could start with, Cynthia. It's good for the mental health and for your hands. Well, guys, I think we had just an amazing group of people that really showed that, it's okay right now for all of us to be not simply unokay, but just, everyone's struggling right now, and that there's so many resources, and we have a list on our website of resources as well, from finding your perfect therapist to ways to distract yourself. We have, there's so many things we can do.
Well, and I mean, the other thing too that Danielle brought up there at the end that I'm going to carry after this conversation is fear of what's next, and fear of when we get back, like the idea of, and she used it there in a marriage relationship, but I think you can apply it to anything that you're experiencing in your life, whether you're married or single or wherever you're working, that kind of thing. The idea of, okay, this has changed the world, and what if I like this more than what it was before? And what if I appreciate this aspect of my life more than I used to before this started? What does that mean? How do I change? That's big and scary to me a little bit to think about that.
Agreed. Yeah,
it is. It is.
Well, this has been fantastic. And ladies, I want to thank you as well for being part of this. And if you're not familiar, if you haven't been watching 41 Action News, as I said at the beginning of this is all part of our new initiative here at 41 Action News. It's called The Rebound Kansas City. I want to tell you about a couple of ways that you can be in touch with us on that. You can email us at rebound@kshb.com. Your thoughts, your story ideas, your questions. You can call our hotline, 816-932-0500, I believe is the full number. Yeah, 816-932-0500. You can call that. You can email us. You can reach out to us, because we want to tell more stories like this. This is not going to be the end of this. We hope to release this conversation in podcast form under 41 Files, but there may be other ways we discuss it. And ladies, you and I are all kind of trying to stay in this mental health vein a little bit and continue to tell more stories. And I know both of you are excited about that moving forward.
Yeah, we'd love to have people
100%.
share their stories. We want to share it, because you know why? We feel connected when we understand our common ground, that we're all in this together. We're experiencing similar things, and it makes a difference, and it matters.
Yeah, and your physical health as well as your mental health is just so important right now. We want to be able to give you those tips, because we're like everyone else. We're human, and we all struggle, and we want to be able to give the best resources we can, and use the platform that we were given in this world for some good.
So all of us have heard, I don't watch the news because I don't like what's on the news. This is your chance to affect that. And we want to tell stories that are going to be meaningful to you and are going to be helpful, beneficial, impactful. That's what we're trying to do. And this is your chance to reach out to us. So more than ever, we're asking you to do so. This has been incredible. Ladies, thank you for your time. Thank you for joining us from home studios or from wherever else, and all the work being put in to bring the guests you brought in. Really, thank you very, very much.
All right.
Thanks, Taylor.
For Cynthia Newsome and Jordan Betts, I'm Taylor Hemness for 41 Action News and for 41 Files. Thanks for listening.